Rabies is a deadly disease that affects the central nervous system of mammals, including humans, cattle, and is nearly always fatal once symptoms appear. It is transmitted through the saliva of an infected animal, usually via bite or scratch from animals such as bats, skunks, raccoons, and foxes, but dogs and cats can also get the disease if not vaccinated. In Uganda, thousands of suspected human cases are recorded annually, with a significant burden on healthcare and livelihoods.
Rabies is endemic in Uganda. It is an unwelcome presence reported in almost every district across Uganda. From 2021 to 2024, the Ministry of Health recorded 67,398 cases of suspected human bites cases from these bites.
Addressing the media at Uganda Media Center in Kampala, Minister of State for Animal Industry, Rwamirama, indicated how the disease is very catastrophic economically, resulting in death of both human beings and livestock. He explained how the country spends billions in purchasing medicines for rabies.
Rabies is an economically important disease causing substantial losses, including the loss of human lives and livestock, as well as the disabilities resulting from bites. These expenses related to the procurement of vaccine, especially rabies vaccine for humans, and post-exposure prophylaxis have also been extremely high. 7 billion Uganda shillings each year to purchase anti-rabies treatment for humans, and more than 1 billion shillings annually for procurement rabies vaccine for animals.
According to the Minister of Agriculture, Animal Industries and Fisheries, the most affected districts by rabies in Uganda include Tororo, Busia, Iganga and others in eastern Uganda, Iganga and others in eastern Uganda. In central Uganda, the disease is high in Masaka, Mukono, Kalangala, Butambala, to mention but a few. While in western Uganda, affected districts include Singiro, Chenjejo, Kasese, Rakai, Rubirizi, Mbarara and others. In northern Uganda, Maracha, Alebtong, Ajuman, Apach, Arua and others are the most affected by rabies. The Minister of Agriculture indicated the government interventions to address the disease.
The government of Uganda, through the national medical stores, acquired human anti-rabies vaccine annually and supplies the hospitals districts through Health Center 4 and 3 and referral hospitals. The government procures 500,000 doses of rabies vaccine for vaccination of dogs and cats and supplied them to hotspot districts through the district veterinary officers.
The minister called upon the general public to remain vigilant, providing first aid messages supposing one is bitten by a dog, which is the primary cause of rabies disease.
Teach the children not to disturb, beat or play with unknown dogs. Report stray dogs in the community to the veterinary officers in your location. Provide food and shelter for your dog and cats so that they do not roam in the community looking for food and end up attacking people or children, or actually contracting rabies through bites of other infected stray animals.
As one of the interventions to address the surge, Uganda will join the rest of the world in commemorating the World Rabies Day, which happens every 28th of September.
Uganda, in solidarity with the global community, marks the annual observance of World Rabies Day every 28th of September, a date of profound significance in honor of Dr. Louis Pasteur's groundbreaking achievement in developing the first rabies vaccine.
With rabies continuing to pose a deadly threat to both humans and animals, government officials warn that prevention remains the most effective defense. As Uganda prepares to mark the World Rabies Day, the message is clear: vaccination, early action, and public vigilance are crucial in ending the needless loss of life from this entirely preventable disease. John Baptista Humza, Church of Uganda, Family TV News at 8.